Welcome back to ER Mentorship Hub. Today, we're diving into a common but often misunderstood emergency procedure, the release of a subungual hematoma. This procedure is crucial for relieving pain and preventing complications in patients with crushed fingers or toes. Subungual hematomas are usually caused by a crushing injury to the finger or toe, often due to ill-fitted shoes or accidental trauma. The pressure builds up under the nail, leading to intense pain. Let's understand when and why this procedure is necessary. Indications and contraindications. The primary indication for this procedure is intolerable pain with intact nail edges. However, it's important to consider contraindications, such as disrupted nail edges, manageable pain, local skin infections, or bleeding disorders. Let's delve into these critical aspects. Materials and preparation. Preparing for the procedure requires specific materials: an electrocautery tool or needles, betadine for sterilization, gloves, and topical antibiotic. Optional materials include a finger splint and lidocaine for local anesthesia. Proper preparation is key for a successful outcome. Procedure. Let's delve into the procedure of subungual hematoma release, step by step, emphasizing the importance of precision and care. First, we ensure the patient's comfort, positioning their affected finger or toe on a flat, stable surface. Safety is paramount, so we don full protective gear: gloves, gown, and eye protection. We begin with a meticulous skin preparation. Using betadine, we sterilize the area around the nail to reduce the risk of infection. This is a critical step, as maintaining a sterile field is crucial for any invasive procedure. In cases where the hematoma is extensive or if the patient is in severe pain, we consider administering a digital block. This involves injecting 1 or 2% lidocaine without epinephrine around the affected digit to numb the area, providing relief and making the procedure more tolerable for the patient. Now, we move on to the key part of the procedure: trephination. This is where precision is vital. We select the appropriate tool, either an electrocautery device or a needle, an 18-gauge single bevel needle for a single hole or a 23-gauge double bevel needle for potentially multiple holes. Holding the tool between the thumb and index finger, we gently apply pressure on the nail, targeting either the base of the nail bed or the center of the hematoma, depending on the hematoma's location. It's essential to apply just enough pressure to penetrate the nail but not so much as to damage the nail bed underneath. The moment we feel no resistance and see dark blood oozing out, we stop. This signifies that the pressure under the nail has been relieved. For an 18-gauge needle, usually, a single hole is sufficient, but for a 23-gauge needle, we might need to create multiple holes to ensure adequate drainage. Throughout this process, we're careful to avoid applying excessive pressure to prevent any additional injury to the nail bed. Once the trephination is successful, we gently squeeze the tip of the digit to encourage further drainage of the hematoma. If bleeding continues, we elevate the digit and apply firm, continuous pressure with a gauze piece over the nail. This step-by-step approach ensures effective relief from the painful pressure of a subungual hematoma while minimizing the risks of further complications. Post-procedure care. Once the procedure is completed, it's important to apply light pressure for drainage, use a topical antibiotic, and dress the wound. We might also recommend a finger splint for comfort. Key advice for the patient includes keeping the finger or toe dry and elevated. Complications. Complications are rare but can include infection or injury to the nail bed. It's essential to be aware of these risks. Our pearls of wisdom include the need for multiple holes for drainage, caution with electrocautery, and avoiding certain improvised tools due to safety concerns. Subungual hematoma release is a straightforward yet delicate procedure that can provide immense relief to patients. It requires careful assessment and technique. Thank you for joining us at ER Mentorship Hub for this insightful session. Remember, your expertise can make a significant difference in patient outcomes. For more informative content, don't forget to like, share, and subscribe. Stay skilled, stay informed,